When we think about stroke recovery, we almost immediately picture physical mobility or speech therapy, right? But there's this hidden, incredibly disruptive challenge that often gets overlooked: vision loss. Welcome to this explainer. Today, we are absolutely cutting through all that dense medical jargon. We're going to map out the official clinical and therapeutic guidelines for post-stroke visual complications. Think of this as your clear, straightforward roadmap to how the medical community actually structures vision rehab. Let's dive in.
So, how exactly does a stroke mess with the way we see the world? I mean, it's really not as simple as things just getting a little blurry or suddenly needing a stronger pair of glasses. No, a stroke fundamentally hijacks the complex communication pathways between your eyes and your brain. It's like the Wi-Fi signal between them just drops. Understanding that specific mechanism is absolutely crucial. It's our first step in this whole journey.
To give you a quick lay of the land, we're covering four main areas today. First, overarching vision changes after a stroke. Second, we'll define impairments like hemianopia. Third, we'll look at the clinical guidance for visual rehab. And finally, we'll wrap up with the occupational therapy practice guidelines.
All right, let's jump right into Section 1, Vision Changes After Stroke, and really understanding their impact. Here's something that surprises a lot of people. Vision issues post-stroke aren't actually about the eyes themselves most of the time. It's about how the brain is interpreting what those eyes see. Think of it like a computer. The physical hardware, your eyes, might be working flawlessly, gathering light, focusing images perfectly, all of that. But if the specific part of your brain that translates those signals is damaged, well, the software glitches. The result is a world that suddenly feels incomplete or just visually chaotic. And honestly, that causes enormous mental fatigue for the survivor. Moving on to Section 2, defining hemianopia and impairments, where we are going to demystify some of these dense medical terms. Okay, so one of the most common and profoundly disruptive visual disturbances we see in the official guidance is something called hemianopia. Essentially, this means losing exactly half of your visual field. Imagine looking straight ahead right now. Your right side is perfectly clear, but your left side, it's just a complete void. And here is the kicker. It's not an issue with the left eye or the right eye. It's a neurological field cut that affects your entire spatial perception on one side. So as you can imagine, simple everyday tasks like eating a meal or just walking down a hallway become incredibly disorienting.
To really grasp the clinical guidelines, we have to understand this core difference. On one hand, you have visual impairment. This deals with physical limitations like losing sharpness of vision or a field cut like that hemianopia we just talked about. On the other hand, you have visual-perceptual impairment. This is when the brain struggles to make sense of what totally healthy eyes are clearly seeing. For instance, a patient might be looking at a white coffee cup on a white table. Their eyes see it, but their brain literally can't distinguish the cup from the background or judge the distance needed to reach out and grab it. And this distinction is a real game changer because it dictates entirely different therapeutic strategies.
That brings us right into Section 3, Clinical Guidance for Visual Rehab and how we are standardizing care across the board.
So why does all this official clinical guidance actually matter to you? Well, because it guarantees that treatment is rooted in proven science no matter which clinic you happen to walk into. Historically, the care you got might have depended heavily on the specific hospital you went to, which is kind of scary. But today, comprehensive stroke frameworks provide this internationally recognized playbook. It's a system entirely designed to maximize your visual recovery through strict, evidence-based protocols.
The Stroke Best Practices Framework actually follows a really strictly organized pipeline. First up is screening. This is an immediate check right after the stroke happens to catch any visual red flags right out of the gate. If they do spot some deficits, we move straight to assessment. This is a highly detailed evaluation by specialists, like neuro-ophthalmologists, to pinpoint the exact impairment we're dealing with. And finally, treatment. This is where we apply those targeted, evidence-based rehabilitation strategies. It's a highly methodical process, literally designed to leave no stone unturned.
And finally, let's head into Section 4, Occupational Therapy Practice Guidelines, the path forward.
This is where things get really practical. Occupational therapy takes all those sterile clinical assessments and translates them into empowering, daily action plans for survivors. The primary goal here? Absolutely maximizing your daily independence. For example, if you have hemianopia, an OT isn't just going to jot that down on a chart and send you home. No, they are going to actively train your brain using visual scanning techniques. They'll teach you to physically turn your head to compensate for that blind spot. It's all about adapting your environment, doing things like modifying the lighting and contrasting your home, just to ensure your safety and help restore your overall quality of life.
The whole patient journey here is really a continuous dynamic loop. Step 1 is assessment, where we identify your specific daily hurdles. Then step 2 is intervention. This is the active part where you practice new skills and start using visual aids. But, it never just stops there. Step 3 is evaluation, which means constantly monitoring your progress. Are those scanning techniques actually working for you? Do we need to try different kitchen lighting? This feedback loop ensures that the therapy is constantly adapting right alongside you as your brain heals.
So, the big takeaway from this explainer is that vision recovery after a stroke really isn't some unsolvable mystery. It's a guided, evidence-based journey from that very first screening right on through to your occupational therapy. Honestly, just knowing this roadmap exists removes a massive burden of anxiety for both patients and their caregivers. But as our understanding of neuroplasticity, the brain's incredible, almost magical ability to rewire itself, continues to deepen, it leaves us with one really exciting question to think about. With these best practices as our foundation, how will future clinical innovations make this entire restorative process even better?